at Pure Plastic Surgery today, and it's Hump Day with Dr. Alex Earl. And today we have a very, very special guest here with us for her first Hump Day. It's Dr. Natty V, Dr. Vidal. All right. We're super, super excited to have her. She's going to be joining us here at Pure pretty soon, I believe. The first official start date is going to be mid-August. And so she kind of stopped by here today to kind of introduce herself to you guys and, of course, answer some of the questions that you may have for her. But once again, I say we're super excited. And yeah, starting in August, she'll be here full time.
Yes.
That's right.
Yes.
Okay. So a lot of people, patients ask kind of what type of procedure she's going to be doing. So she's going to be doing pretty much, plastic surgery, cosmetic procedures, almost like head to toe, right?
Yeah.
You're pretty comfortable with everything. So, of course, a lot of body work. So any breast procedures, breast aug, breast lift, breast reductions. We'll be doing the mommy makeovers, tummy tucks, liposuction, BBL. She also has some interest in some of the things that I don't do as much. So facelift, neck lift, and labiaplasty as well, right?
Yes.
That's true. So yeah, that's one thing that we're also excited about. We've never been able to offer that here at Pure, so we will be able to do so moving forward. All right, guys. So it's kind of a free for all here. We'll take all your questions. You can. She's happy to answer. If you want to learn more about herself, her training, her education, and things of that nature.
First question. So we know you're probably learning a lot from Dr. Earl, but what do you think you can offer to the practice that is currently not being offered?
I can learn a lot.
Heavy question here.
Yes.
Yeah.
Excellent.
I can learn a lot, but I think complementing my female touch will help Dr. Earl's practice. And also the procedures that he does, he doesn't offer like the labiaplasty, so looking forward to all of that.
Yeah, excellent. So I agree with that. So definitely there are some procedures that Dr. Vidal will be doing, which I'm just not that into. Facelift, neck lift, labiaplasty, that's definitely going to be something that we're going to be promoting much more heavily now, and that she's going to be able to contribute as well.
I also like to do some non-surgicals like Botox, Dysport fillers. Then I'll be offering that as well too. So.
That's great. So as you know, we haven't been doing a lot of that since COVID. We've been trying to minimize the amount of flow through the clinic. But now that more and more people are getting vaccinated, there's less and less cases. That's definitely an aspect of the practice that we're looking to then start over again and expand as well.
Will you be offering dimpleplasty? I've never heard of it, but I'm sure you guys have.
So I don't do that. I haven't really been seeing it done. How about yourself? Have you seen that? No? All
And
right.
a question about the labiaplasty.
Yes.
How long is that procedure and what is it like?
The procedure is not that long. It's a procedure done mainly under local anesthesia. The recovery is not that painful. You can go home the same day, and usually the sutures are absorbable, so there's not a lot of suture removal, and there's some swelling afterwards, like any procedure, but it's very tolerable, and the pain is also very tolerable.
And
One of the main questions regarding that, which I'm sure is going to come up, is they may be embarrassed to ask, but how long, no sex for how long?
that was literally the next question. You're on it.
Yeah, we want everything to be healed, so at least 2 weeks, and then slowly.
Yes.
We'll talk about it a little bit later, but yes, that is one of the things that we need to be careful not to open up the repair.
All right, excellent.
So there's many safety features that Dr. Earl implements. Are you using the same things?
Definitely. Safety is one of my priorities, as Dr. Earl is, and I'm on board in all those.
Yeah, so that's a great question. So it's one of the reasons I think why we chose Dr. Vidal and why she chose us. So safety is definitely our primary concern. We already have a lot of established protocols here at Pure, which are already in place, which of course will be continuing. All the surgeries are of course being done at Pure with the same equipment, personnel, protocols, etc. And then a lot of the safety features, of course, Dr. Vidal will be implementing as well. For example, the cell saver, ultrasound for the BBL, and things of that nature. And then on top of that, we're also going to be using the same anesthesia provider. So as you guys know, we have Raquel, who's here, and then sometimes, Carlos also here as well. So anesthesia is going to be, top notch moving forward.
Back to the earlier, did you say you were going to do the labiaplasty under local?
Yes.
Okay. So that under local, there's no pain, same thing as the...
Yeah, yes, there's the pain of the anesthesia. There's an injection involved for that. But we can discuss that with the patient and where are the goals and benefits for the procedure. We can offer it with sedation as well, so we can also address that later on, yes.
You'll probably have 3 choices depending on
Yes.
the level of comfort. So you can do straight local, which there's going to be some initial discomfort due to the injection. But then there's also what they call twilight or sedation. So similar to like if you're going to have a colonoscopy, that type of anesthesia where you're of course sedated, you're not really feeling anything, but you're not so knocked out that you need the tube in the throat. And then of course the last option, which we always offer for any procedure, would be the general anesthesia.
Are you requiring your patients to be vaccinated?
No.
Or is that a pure
No.
pure policy?
Yeah,
Pure policy
that's
question.
That's not a pure policy. So no, we do not require patients to be vaccinated. And all these the COVID protocols are always in flux. So as of right now, they're fairly similar to how they've been for the past few months. So we're still requiring a nasal swab PCR test within 72 hours of surgery or your pre-op day. And that's still in place, and that's essentially for all patients. And we may change some of that moving forward, in terms of like those patients that are vaccinated, whether they still need to continue to do that or not. But as of right now, those protocols are still in place. And it's just for safety. I mean, a lot of our staff is vaccinated. I know I am. I think we both are as well. But not 100% of our staff is vaccinated. So that's why we still don't know whether someone can be a carrier, they're vaccinated or not, and things like that. So that PCR test protocol is still in place.
For Dr. V, how long have you been at this, at going to school and intending to be a plastic surgeon, and where are you at in that journey?
I finished medical school in 2012. And after that, I started my general surgery residency. That's 5 years. So I finished that. I did that in Puerto Rico, in San Juan. I did until 2017. Then I did a year of burn surgery at New York City, Jacobi Medical Center. And then in 2018, I started my plastic surgery training. I completed now at the end of July at the University of Miami. So operating for the last 9 years.
Perfect. And when you chose plastic surgery, or plastic surgery chose you, how was that? Did you guys have to figure out a right fit for each other, or was it just Dr. Earl pointing a finger?
No. Her choice of my surgery was way before we even met.
Yes.
But tell me a little about that. What kind of drove you towards plastic surgery?
I kind of jumped a little in specialties, but in general surgery, I fell in love with the reconstructive aspect of it first, and that's why I did the year of burn and reconstructive surgery. And then that turns into, helping in all the aspects of plastic surgery, and I started then falling in love with the aesthetic portion of it, which have seen that the results and the how you can change someone's life, and that's how then I got driven into this beautiful field.
Beautiful.
That's right. So plastic surgery may not be considered, of course, life-saving surgery, but it does. And we see it in our patients like all the time, how it really tremendously affects the way they feel about themselves, self-esteem, confidence, and so it definitely affects the quality of life of a patient. I think moving forward, I think that's one of the things that that you pointed out that you care about a lot is really, really kind of changing, improving that quality of life and that confidence and self-esteem in our patients.
Not life-saving, but life-changing, definitely.
So we have a more general surgical question. Is 6 months postpartum too early to get a lipo 360?
All right. So no. So at 6 months, you can definitely have your liposuction procedure. Okay. And that's okay whether you have, just a vaginal birth or your C-section. 6 months is adequate time. You shouldn't do it before that then, because you want to give your body enough time to kind of settle down and heal.
Will Dr. V be doing body tight?
Yes, I'll be offering body tight as well.
That's right. So that's what we have here at Pure. That's the machine that we use. So you should definitely be using the body tight.
Is Dr. V's prices the same as Dr. Earl's?
Right.
No.
So it's not going to be the same price point. There are going to be different price points there. Of course, as per all our quotes, they're very kind of individualized or tailored. Right. We're not doing kind of cookie cutter surgeries, and we don't have necessarily cookie cutter quotes. Okay. So the best thing that you can do, of course, is do your virtual consultation. And then a coordinator will reach out to you, and she'll be able to give you all that information and all those details, okay? And where do you go for your virtual consultation? So you're going to go to the website, right? You're going to go to www.pureplasticsurgery.com, and then there's going to be a button there. It's going to say virtual consult. You hit that button, and then there's going to be a form that you have to fill out. Now, what's very important is you got to fill out every single aspect of that form, okay? Plus your 3 photos. So that the form is able to go through. If you miss one, and sometimes there'll be like an error message, so make sure you fill out every single line on that form, and then you have a coordinator reach out to you, and then she'll be able to kind of finesse all the details and give you all the information you need.
Thank you very much. Does Dr. V speak fluent Spanish?
I do. I'm from Puerto Rico, so yes, fluent Spanish. Spanish is my first language, so.
All right, perfect. And what is Dr. V's BMI requirement?
So the max that I'll be doing is 35, but I do recommend everyone to be at a goal weight and healthy. So if you can be closer to less than 30, it's even better because the results are going to be better. Your post-op complications will decrease, and you have a better outcome.
So we know ultrasound has been around for a few years. With Dr. Earl's been using it. How has training for that been going for you?
Yeah, I have trained with ultrasound, and also I'll be using it with Dr. Earl.
Yeah, so that's been going really well. So yeah, we've been doing a few cases. I've been showing her how to what's the best technique with the ultrasound, some of the the BBL techniques that I use and I employ. So it's basically taking everything that I've learned in the past 3 years. And I've been and she's like on the fast course,
yes.
which is great. Yeah, which is great for you. So so she's able to really absorb that. And she's absorbing it really, really great. So we're excited about that, and using all those techniques.
Surgical question for Dr. V. So Dr. Earl, I don't even know. There are a lot of Dr. V questions.
Yeah,
You just sit back, sit back, relax.
You want me to just sit here and look pretty?
Yes. So, Dr. V, I've had 3 kids back to back, 2 via C-section. What's included in a mommy makeover?
So it depends on what your expectations of the surgery, but mommy makeover is usually like a tummy tuck and then a breast procedure, depending on what you want, like what's the shape of your breast and what is the goal. It includes a lift, an AUG, or a combination.
Perfect. Next question, Dr. V, of course. Are you accepting new surgery patients in September?
Yes, I'll be starting mid-August, so please fill the quote through the website, as Dr. Earl explained. So, yes. Yes.
Okay, so that is one of the great things of having Dr. Vidal here with us is that now you don't have to wait 6+ months to have your surgery here at Pure. So she definitely has openings in the schedule. First official date is mid-August, like she just said. And so, we are taking patients throughout the fall and the winter of this year. That's right.
So I know you went over this again with a few questions. So her earliest availability is August?
17 is my first,
Yeah, that's the first, I believe, surgical day, correct?
Yes,
yeah.
Surgical day, yes.
Yeah.
But you have to go through the coordinators because I don't know if I'm booked or not.
Yeah, so actually she's starting to book pretty quickly. So I'm not sure if this specific day is going to be available anymore. So the best thing to do is like once again, talk to your coordinator. They have the entire kind of calendar and entire schedule there, and so they'll be able to help you. But again, the good news is that there's a lot more availability this year.
Surgical question for either one of you guys. What is the benefit of a tummy tuck and lipo and adding lipo 360 afterwards? What do you recommend? The lipo 360 as an add-on or usually as a tummy tuck with the lipo the flanks adequate?
Right.
It depends on how much loose skin you have and the quality of the skin. So it depends on if you have some loose skin but the quality is good and you'll be able to contract versus you have too much loose skin, then it's better to do tummy tuck first, tighten everything, and then come back for a 360 lipo.
Yeah, I agree 100%. So in general, if there is skin laxity, I think it's best to do the tummy tuck first as well. And then with that, of course, you get some lipo to the flanks and the waist. But then you can come back 3 to 4 months later and get the lipo 360 again. Remember, the same rules that apply to me apply to Dr. Vidal, and honestly, they should apply to every single surgeon in Florida, okay? So the rules are that if you're doing a tummy tuck, then you can only remove 1 liter or 1,000 cc's of fat via liposuction at that time. And if you're doing lipo alone, with lipo or fat transfer, then you can of course go to the upper limit, which is 4,000 cc's.
So you mentioned that your prices are going to be different. Is the deposit going to be different or the same?
So the deposit is a percentage, right?
Correct.
So it's a 20% down deposit, so that doesn't change. But remember, as opposed to many other places, the deposit is 100% refundable until you're within 30 days of surgery. Okay. So honestly, you have nothing to lose. Okay. By placing the deposit, you're able to secure your date. Okay, before things fill up, and believe me, they're gonna fill up fast. Okay, the way the buzz that we've been hearing, she's gonna fill up very quickly. So if you want to set a date, you place your deposit, but we understand, life happens. Maybe something bad happens. You need that. Okay, that's okay. You're 100% refundable to within 30 days of surgery.
So we see Dr. Earl has great tummy tuck results on the site. But Dr. V, can you fix a hernia at the same time as you do a tummy tuck?
Depends on the size of the hernia, but yes, we can fix a small hernia at the tummy tuck. Yes.
Yeah. So and we typically don't see like the huge hernias here. So yes, typically more like a small belly button hernia, maybe a small ventral hernia, and that would be very, very doable at the time of the tummy tuck.
Dr. V, so when you're in training, do you know how many surgeries you do, or just a number of mommy makeovers, let's say, roughly?
Roughly it varies because when you're in training, you have different classifications that you have to meet. There's a number of cases that you need to complete to be certified and be able to graduate. So I've completed all my numbers and have passed. Thankfully, at the University of Miami, I've had no problem completing all my numbers. So.
And do you intend to be board certified?
Yes, I'm in the process of the board certification, yes.
Beautiful. Question on surgical. After a breast augmentation, when are you able to sleep on your side or back?
So I would say a couple of weeks to have everything healed very well, and before starting to put pressure on the implants and on the breast. Yeah,
so when on your back, you're going to be on your back, so you're going to be there in the beginning. I guess the question is, at the beginning, you're typically a bit inclined, like you want to be raised up, and you want to do that for 2 weeks, and then you can lay a bit more flat on your back. And then the sides, you probably want to give it a little bit more time, another couple weeks, so 4 weeks out.
So we know that Dr. Earl has capped his patients at 5 per day to stay fresh and safe. Is there a cap for Dr. V?
We'll be, yes, definitely. I want to keep the same safety profile, but we'll have to coordinate with the OR availability and the personnel, so we'll both be working together here.
Right, so the cap's it's probably going to be similar, which is 5. Again, all the same kind of safety types of protocols are going to be in place, and those will not change.
Where can we see Dr. V's work?
here.
All right, so I wrote it down. So she does have a IG handle. So it's at Dr.Naty_V. Okay, and we have she's newly, a little bit newer to social media and Instagram than I am. And so she's working on it, and she's getting all her stuff together and putting it out there. So slowly building up. But yes, please keep an eye on that. Definitely keep an eye on that. And you're gonna be right. You're gonna be putting more and more stuff there as the days go by, and of course as the start date gets here soon. A lot of people are asking whether she has a Facebook group. So there is no Facebook group right now. It's probably something that we're gonna do in the near future. But as of right now, you can just go to the Earl's Pearls Facebook group, and you can start kind of asking your questions through there.
We know that you don't combine a tummy tuck with a BBL. Will Dr. V be able to combine a tummy tuck BBL?
No, sorry. Safety first, right? It's the same reasons that Dr. Earl doesn't combine it. Same reasons I don't combine it as well. Positioning, safety, which will alter and compromise your results of one or the other degree.
Right, and also what we just mentioned, you can't remove that much fat when you're doing a tummy tuck. So for most patients, that's not going to be enough fat to remove and not enough fat to then place for an adequate change in the buttock area.
I know you've answered this question a lot, Dr. Earl. For Dr. V, what do you recommend first, a BBL or a mommy makeover?
Yes, similar to the previous question of the 360 and tummy tuck, it will depend on the skin laxity, skin quality, and your goals. If you have a lot of skin laxity and the quality of the skin is more stretched, then I would recommend first doing the tummy tuck and then doing the BBL later on.
Will you be conducting in-person consultations or FaceTime or both?
Both. Yes, FaceTime consultations, I think it's more reachable for most of the patients, but yes, we can also coordinate person consults.
Okay, great. So then the next is actually pertains to that for Dr. Earl. Do you know, so when we'll open up for in-person consults?
So we don't have a start date on that. Again, similar to the COVID protocols, we are starting to think about easing into opening that back up. A lot of it also will depend a little bit on finishing our expansion. So many of you guys know that, of course, we're not only expanding the number of surgeons here, but with that, of course, comes a physical expansion as well. So that's kind of another step that we're currently working on. So as soon as that's done, then we'll also have more space, and we'll be able to open up more to in-person consults as well.
What areas is the ultrasound used during a BBL?
To the critical area specifically, was in the inner area of the buttock, but I use it for the infiltration in all the buttock area. But yes, Dr. Earl will do the diagram.
The
here.
critical area.
Yeah.
Yes.
The danger zone.
Danger zone.
Yes, so that's a very crude drawing of a buttock. Then, for a distance of approximately 12 centimeters or so from the midline, that's what we call the danger zone, okay? And why is that? Because that's where those vessels are. Roughly one's around here and one's around here. That's the superior and inferior gluteal vessels, okay, which are the ones that you have to be careful with. So the ultrasound is used when you're within this zone, okay, to make sure the cannula is, safely above the muscle, okay, and that what we call that subcutaneous plane between the skin and the muscle, okay. Once you start getting out here, start getting out to the kind of the hip areas, there are no dangerous vessels there, so there's really no need for the ultrasound, and that can be done without the ultrasound to try to, do the hip areas and pop out the hips.
Will Dr. V be making some info videos in Spanish, or are you open to that?
I mean, I can definitely work on that. If that's not a problem. Yes.
Yeah, I think that's a great idea. That's a great idea. We're gonna put her to work, do those.
Yes, you're the English slides. She's.
Yeah,
Spanish lives.
yeah, I mean, a lot of those things will be coming. So,
Yeah.
you know, I know you guys follow me through various channels. And so, of course, we're going to start developing all those channels for Dr. Vidal as well. And you know, a lot of that content can be in Spanish as well, which I think, honestly, something that I haven't done a lot with, and I think we should do more, and that'd be a great opportunity for her to be involved with that.
Can you fix a hernia during a BBL?
I mean, for a BBL, we're not doing open incisions, so we're just doing the liposuction and then the fat graft, so I wouldn't combine that with a BBL.
Yeah.
Thank you.
Yeah.
Any follow-up?
No, I agree with that 100%. So you guys heard me as well. So for the most part, combine it with the tummy tuck because we're opening things up. We're having a direct look. But if you have, especially if you have a significant hernia, you shouldn't be doing the liposuction.
Yeah.
You should be getting that hernia fixed first. Otherwise, it can be dangerous. And then going and do your liposuction.
Dr. V, will you be present at my pre-op appointment or before surgery?
Of course, 100%.
No doubt. Okay.
Yes.
Just during your training, you conducted BBLs as well?
Yes, I did.
Is there a surgery that you like doing the most?
That's a tricky question for a plastic surgeon since we operate from head to toe. I enjoy most of the plastic surgery, but I think one of the most that I enjoy is breast procedures. Combination of lifts, reductions, or augmentations. Yeah.
All right.
When I visit the site, how can I get a quote for Dr. V versus Dr. E?
So I'm not sure we have that drop-down menu there, but don't worry about that. So what you do is just go ahead and fill out the form as best as you can. Like I said, make sure you fill out all of the fields. Make sure that the photos are adequate and everything else, so the form actually goes through. Don't worry if it's 100% accurate or 100% exactly what you need, because what's going to happen is that you're then going to get a call from one of our coordinators. Okay, so you're going to have plenty of opportunity to go into the details of exactly what you're looking for, and exactly which surgeon you're looking at or both, and they can give you all that information. So really, the first step is just to make sure you adequately fill out the form, make sure that it's sent in, and then our coordinators will reach out and they'll take care of the rest.
If I just had my baby, congratulations. How long do I have to wait for a tummy tuck and a BBL?
Yes, at least 6 months, like we mentioned before, so everything settles down, and then you can go ahead and have the evaluation for that.
So 6 months after postpartum, and then 6 months after one surgery to the next.
Correct.
Yeah.
Okay, I can't wait for my turn with Dr. Natalia
All right.
Vidal. I'm so excited. Let's see. Oh, so many. All right, a lot of pricing questions. You can DM us for pricing. Reach out to our coordinators. Is Dr. Earl present when Dr. V performs surgeries?
So we're doing some surgeries where I've been kind of showing her our techniques, showing her about the ultrasound and stuff like that. So there's certainly going to be some surgeries where I will be present and just kind of demonstrating how I like to do things. Doesn't necessarily mean she's going to do it that way, but I do want to kind of show her a lot of things that I've learned over the years. Now, am I going to be there for every single surgery? No. She's going to have her own patients, her own surgery time, and everything else.
And is her OR team her own OR team, or is it you guys? You're the same ones that you work with, Dr. Earl, the anesthesia and your anesthesia stays the same.
So it's pretty much the OR team that we have here at Pure. Of course, with the expansion and her surgeries and everything else, we're going to be hiring more staff. So there's going to be more staff that are going to be hired, but the anesthesia providers are going to be the same. A lot of our nurses or circulators or recovery room surgical assistants are going to be all the ones that are currently in place, plus some new added staff. Okay,
that was the specific part of the question. So the anesthesia stays the same because what you have is really good.
Yeah.
I have my surgery in August. I need to know if I want to add another procedure with my mommy makeover, for example, arm lipo. Can I do that?
Yes. Yeah.
So again, we are limited to that 1,000 cc's, but with the Mind Makeover, typically small areas of lipo are okay to add, such as arm lipo or maybe a chin lipo. What we typically don't do is add like a large area, like say like the back. We're not gonna do back lipo and a mind makeover at the same time.
At what point does the skin reach maximum tightness after lipo? If my skin isn't perfectly tight at 10 weeks, is there a chance for it to retract even more?
Yes, I mean, the whole healing process, it can take up to a year. So, I mean, the retraction will happen the first few weeks faster, but then it will continue to retract and heal more over time.
Hello, Dr. V. What day will you see me post-operative?
I mean, that depends on the scheduling and what day I do surgery, but I will definitely see you post-op, early post-op.
Yeah, so right now, so it'll be similar to kind of my protocol as well. So a lot of times, post-op day 1, if you're having your massages in-house, then she'll see you there. If you're not, then it may be a virtual post-op visit. And then certainly at post-op day, typically post-op day 5 is your in-person post-op visit with your surgeon.
All right, this always goes so fast. We're already at half an hour. I know you guys. Yeah, you got the schedule's even tighter right now. But a few more questions.
All right.
So sorry to everybody if we couldn't get to your question. Does the BBL include lipo 360, and does the lipo go to the upper back?
Yes, it takes the upper back, lower back, and the abdomen, and the fat grafting to the buttock, yes, and hips.
So lipo 360, pretty much the entire back, unless you have what we call a buffalo hump. Okay, so buffalo hump is some people have that hump like way up here. If there is a buffalo hump and you want us to take care of that, then that is an additional. But other than that, it's pretty much the entire back.
Dr. Earl, we know that there's a pretty long wait list for you, and if somebody cancels, do you fill that spot with the people on a wait list?
Yes. So we do have a wait list, and so when we have cancellations, then we go to the wait list. Once you're on that wait list, it is a little bit of kind of first come first serve. So if you want to try to get your surgery sooner, the best thing you can do is go ahead. Place your deposit, secure a date, and get on the wait list. Okay, that your coordinator know that there's, say, okay, I don't think I'm open till like March, but you secure your date. Then you let your coordinator know that there's you really want to do something in November, and so then that way, as soon as we have a cancellation in November, they can go to that November wait list and try to fit you in.
So Dr. Earl, we know you're not a fan of performing fat transfers to the breast. Is this something that Dr. V will be doing?
I feel the same way as Dr. Earl feels about fat grafting to the breast, that the change is not as dramatic, and I think that the outcome is better with an implant if you're looking for an hub. Yeah. Thank
you very much. All right, for the last few questions, this is a test for you right now, Dr. V.
Oh my God.
So Dr. Vidal, can you please explain in Spanish your opinion on BBL versus tummy tuck?
En español. Okay. Voy a tratar de no hacer Spanglish.
Yes.
a ver si me sale. Depende de las metas que tengas y cómo tú quieres y cómo tú visualizas el resultado y cuán suelta y la calidad de tu piel. So, si tienes mucha piel suelta, especialmente en la parte de abajo del abdomen, es mejor empezar con un tummy tuck y luego entonces hacer el BBL con liposucción.
You passed your test. She speaks Spanish, everybody. I think we can end on that. Thank you very much. Thank you,
awesome.
Both doctors.
All right, great. Well, it's a pleasure to have you here today. It's gonna, we're super excited once again to have her here full time. And moving forward, very likely that you may have your own lives and things like that. So, like I said, all those kind of channels where you see us, where you follow us, we're in the works of creating all that for Dr. Vidal as well. But in the meantime, you're gonna have to just stick with me next Wednesday for a hump day with Dr. Alex Earl.